Hello, Dixon Family Practice. My name's Soren Tjernell. I'm with the Community Clinic Consortium, and many of you will recognize me. I periodically come to your staff meetings and talk to you about government affairs, and particularly how different things happening at the state legislature and at the U.S. Congress are affecting community clinics and our patients. Today I want to talk to you about national healthcare reform. It's a topic I'm sure many of you are wondering about, many of you are reading about, hearing different things on news, etc. Patients may be asking you questions. So I want to bring you up to speed on where the legislation stands right now in Congress, what the timeline is for passing this legislation, what the bills have in them that would be good for our clinics and our patients, and then how we can weigh in to do something to make the bills as good as they can possibly be by the time they make it to the President for signature. So the first thing that I'll do is just start out with a very quick sort of clip that shows and walks through the very basics of the legislative process, which will allow us to see exactly where the legislation stands now and where we can weigh in to make a difference.
Okay, here's a minute-and-a-half version of the legislative process. The picture up top stands for the United States House of Representatives. The picture on the bottom for the United States Senate. Those are the two houses of Congress. The representative for Dixon Family Practice is John Garamendi. And the U.S. House, actually, a couple weekends ago, passed its version of healthcare reform already. So it's ahead of the Senate. The Senate, where we as Californians are represented by Dianne Feinstein and Barbara Boxer, has not yet consolidated all of its ideas into a single bill, in part because it takes 60 votes for anything really to pass through the Senate before it can go on to the conference committee, where it merges with the House's bill and then moves on to the President for signature. So again, to quickly sort of sum up, the House has already passed its own legislation. The Senate has not yet passed its own legislation, but will do so once it gets 60 votes. Once it does, it will go to a conference committee where it will merge with the House bill and then go on to the President for signature. The places that we have as grassroots advocates to weigh in and make a difference are here at the Senate floor, where we can try to convince our senators to put in provisions in the bill that help community clinics and our patients. And also then again, once before it goes to the conference committee, we can again weigh in and try to make sure the bill contains things that are important to us. Because after that, it goes to the President for signature, and once he's done that, we can all celebrate.
Okay, so that gives you a sense of the process of where this legislation stands. The question remains, what do these bills have in them? And there's really three things I want to talk about briefly. The first is that all of the versions of legislation in Congress right now would dramatically expand the Medi-Cal program, meaning that a lot more people who currently come into Dixon Family Practice as uninsured would actually post-reform come in as Medi-Cal patients, meaning higher rates of payments to clinics, which is great for us, but also a greater scope of services for our patients, including hospital care, specialty services, long-term care, those sorts of things. The second thing is contained in the House of Representatives version of the bill. It's a provision called the Public Health Investment Fund, and it would contain $12 billion to be spent on community clinics like Dixon Family Practice over the next 5 years, allowing for service expansions, more staff, more new sites, basically allowing community clinics to grow to meet the demand that patients have for our services. Another thing that's super important that is not settled in this legislation is whether or not private insurers would be required to contract with community clinics. It's important that community clinics are part of the provider networks that private health insurance companies contract with, like Blue Cross or Kaiser and others, to make sure that our patients who know and trust our services can continue coming to us when they get placed on private insurance. Because part of what healthcare reform is going to try to do is get more people onto private insurance and get other people onto Medi-Cal. The idea is that what we want as community clinics is we want to be providers for anyone who wants to come to us. So it's Medi-Cal expansion, Public Health Investment Fund, and inclusion of community clinics in private insurance networks. Those are three major things. So stay tuned, because as I think you can guess, I'm going to be in touch with each of you very soon so that we can weigh in with Dianne Feinstein, Barbara Boxer, even John Garamendi, write letters, make phone calls, do what we can to make sure that these crucial provisions for community clinics remain in health reform before and until it goes to President Obama for signature. So thank you very much, and I will be in touch. And if you have any questions, please drop me an email at any time. I think you all have my email now, and I look forward to talking with you. Bye-bye.